Alright. Hello, so today we'll be going over your current oral health care routine. This is just to find ways on how we can improve it, as well as to address any oral health care concerns that you may have. So it says here that you brush your teeth once a day, that you do not use floss, but you do use a mouth rinse. So I think using mouth rinse is really great. So good job with that. Mouth rinse can really help prevent bad breath, which is I know one of your main concerns today. Mouth rinse can also provide many other benefits, such as remineralizing your teeth, preventing caries and periodontal disease. So I'll have you to continue as you're doing. Another thing I wanted to address is that currently you are brushing your teeth for once a day. The goal is to have you to brush for 2 minutes twice a day. And the reason behind that is to prevent any excess plaque buildup, to reduce any gingival bleeding, as well as periodontal disease. I know that you said that you work really long hours, so it could be hard to even have time to brush your teeth. I would really recommend maybe bringing a travel-sized toothbrush that if you have a break or in between meals, you could go ahead and brush your teeth then. Although if you find this hard to keep up with or not convenient, minimally I want you to brush your teeth at least twice a day, once in the morning for 2 minutes and then once again before bed. And I also wanted to address the arthritis-like pain that you're experiencing. I know it could be very painful and uncomfortable, so I would like to recommend an electrical toothbrush. Electrical toothbrushes are really good because they are low dexterity. It's going to prevent any extra physical exertion that you're experiencing. They basically do all the work for you, and they have a really thick handle on them with grip, so it makes toothbrushing a lot easier. And that leads me to my next thing. So I would like to show you a few toothbrushing techniques on how we can utilize an electrical toothbrush, okay? Alright, so I'm going to show you how we can utilize an electrical toothbrush. So first you want to start by the very posterior teeth, and then you want to angle your toothbrush at a 45-degree angle and place it there along the gingival gum line. And then you want to hold it there for at least 3 seconds. So 1, 2, 3, and then sweep along to the very next set of teeth. 1, 2, 3. 1, 2, 3, and so on until you get to the other side. You also want to repeat this step for the lingual surfaces inside, so it'd be 1, 2, 3, 1, 2, 3, 1, 2, 3, and so forth. And then you also want to do it on the occlusal surfaces, also known as the chewing surfaces, and you'll just go 1, 2, 3, sweep, 1, 2, 3, sweep. All right, and that should really help with reducing any pain you're experiencing and make toothbrushing a lot more easier for you. So to go along with toothbrushing, I like to recommend tongue brushing. Tongue brushing is going to get rid of any food, plaque, or bacteria that's left on the tongue, and this is really going to help freshen up your breath. So normally I would recommend a tongue scraper, but if you don't have a tongue scraper, you could go ahead and just use a normal toothbrush. So you want to start off with the very back of your tongue, and then go ahead and sweep all the way forward, and then from the back of your tongue, and go ahead and sweep all the way forward. And you don't want to go too far back because you don't want to gag or end up choking yourself, so just make sure that you're not too far back. All right, and then another tip would be to just rinse the brush in between strokes. That way you're not going back with what you're trying to remove. So when to replace your toothbrush. So you want to replace your toothbrush every 3 to 4 months. That way, if there's any excess food, plaque, or even dried up toothpaste, you want to go ahead and get a new toothbrush. Another reason is because the bristles can actually get damaged and worn down, and so it's going to be less efficient in brushing your teeth or just cleaning your mouth. So those are just a few things to keep in mind. Alright, so it says here that you typically consume a diet high in sugar. This could be because you work in a bakery and it's very tempting. This is me just not saying don't have any sugar, but just to limit the amount that you intake, just because bacteria in our mouth can actually utilize that sugar and turn it into acid, and in turn that can actually damage our enamel and our dentin, and that eventually leads to caries. So maybe if you do have sugar, just make sure that you're brushing afterwards, and I think you should be okay. So I know that we addressed a lot of things today and it could be very overwhelming. So please let me know what you feel comfortable starting with and also with what you don't. That way we could go from there and can see what best benefits you, okay? Let me know if you have any questions or concerns, and I look forward to seeing you soon. Bye!